This is Dr. Susan Blum. It's lunchtime with Dr. Blum, Facebook Live, so welcome. You know, I've bumped into a few people recently. I was actually at the conference last week in the city at the Integrative Health Symposium, and I get to see all my friends and colleagues, which is really fun. And I get to see just people that in every field in health, whether they're nurse practitioners or health coaches or nutritionists, like all sorts of health professionals show up at this conference. It's a really nice local community from my Metro New York sort of integrated practitioner community. And so I'm giving a shout out to those of you who came up to me and said, I've been watching you on Facebook Live and it was so much fun to know that people are actually watching. I mean, I see the numbers, so I know people are watching, but it was really fun to put a picture and a face to just that someone's following and sharing it. So welcome back. So let's see. The way we do this, as you all know, is the first. I'm going to sort of ramble on a topic for the first 15 minutes, and then I will start answering questions if there are any. Sometimes there aren't that many questions, and I just keep talking. For those of you who know me, you know that I can keep talking pretty easily and have to remember to stop most of the time. And you know, there's just so much great information on all these topics. There's so much to talk about from, when it comes to autoimmunity, especially today our topic is MS, multiple sclerosis, and the gut, specifically sort of talking about that connection. And gosh, we could do sort of hours just talking about the gut, and we could do hours talking about MS, but we'll just sort of try to make some connections for people so they can understand. My goal is to share what we know, and share some understanding about how these two conditions, or how MS as a condition is related to the foundational imbalances that happen in the gut. And so let's first start with multiple sclerosis. And actually, as I say this, it brings to mind one of the reasons why it's been so important for me to talk about autoimmunity from the perspective of all the things that they have in common as different diseases instead of what separates them. One sec. Conventional docs, a patient with MS, which is a nervous system autoimmune disease where the myelin, which is the outer coating of the nerve cells, is damaged from an autoimmune reaction, meaning the immune system attacks the myelin that lines the nerve cells and damages that, and therefore then the nerve gets damaged and can't function. So you actually have severe, you can have anything from mild to severe damage to the nervous system. And conventionally speaking, patients with multiple sclerosis go to neurologists. And patients with other autoimmune diseases like Hashimoto's thyroiditis, they go to an endocrinologist, right? And they get their thyroid checked. And someone with rheumatological autoimmune diseases like rheumatoid arthritis or Sjogren's or lupus, they all go to a rheumatologist. And this has actually been one of the biggest issues in facing the field of autoimmunity. There is no field of autoimmunity, right? So I just told you, everyone with autoimmune diseases scatter and they end up in different places. And so what that has done, it's really impaired the ability, it's impaired research, it's impaired funding. There's the American Cancer Foundation. They research every kind of cancer. There's donations and funding for every kind of cancer, not just breast cancer or not just lymphoma. But instead, in the world of autoimmunity, there's a multiple sclerosis foundation, there's a rheumatoid arthritis foundation, there's a lupus foundation. We don't have a centralized, I say we because, I wrote a book called The Immune System Recovery Plan in 2013, and so if I wasn't already, I became an autoimmune expert by the research and the act of actually writing the book. You do so much research when you write a book, you really become an expert if you weren't already. But there is no field of autoimmunity. And I guess I've become that in functional medicine, integrative medicine. I have become a specialist in autoimmunity, and what I want to share with you is that whole notion that what we have in common is greater than what separates us when it comes to different autoimmune diseases. And therefore, we can take the basic functional medicine principles and apply them to all autoimmune diseases. And these principles are: find the root cause of immune imbalance, find the root cause of what's triggering the immune system to fail. And if you find that root cause, then the immune system can be healed, and you can balance the system again, and the autoimmunity reverses and is treated. And multiple sclerosis is another example of an autoimmune disease that has a very strong association with gut health. Now, I've given many talks on this topic, and pretty much you can Google it and find thousands of articles written in blogs and PubMed and actual studies of this issue of the gut microbiome, a condition called leaky gut syndrome, and all autoimmune diseases. And there are some autoimmune diseases where the research is very, very compelling of this connection, and rheumatoid arthritis is definitely one of them. But MS is another one, and in fact, my great friend and colleague David Perlmutter, he started a journal called the Brain and Gut, right? The Brain and Gut, because there's so much research looking at the relationship of how gut health affects brain health. And so I want to talk a little bit about that today and give you a sense of why that is, how it works, and what you can do about it. So when I have a new patient that comes in with MS, the first thing I always do is, of course, with everybody, is take a thorough history. And the things that I'm very interested in is how's the digestive system. And to try to figure out what's going on with your gut, or if you have likely issues with your digestive system, the first thing we do is history. So what kinds of things in history are important? I'm always looking at childhood use of antibiotics. How much antibiotics have you used during the course of your life? We go back all the way to childhood. Did you have chronic ear infections? Did you have chronic strep? Did you need antibiotics for that? Any history of chronic sinusitis, or any hospitalizations or big infections, or any taking low-dose, long-term antibiotics for acne? These things don't do nothing. Okay, they're important. And so we start thinking about, so check. History of antibiotics. First thing, history of other medications. And this could be like chronic pain and pain meds. And because that affects the gut in a really big way, that will actually damage the tight junction and cause something called a leaky gut, which is associated with MS. And so, history of medications, history of antacids and proton pump inhibitors. Is there a history of reflux, other digestive symptoms, right? So getting a history. History of terrible stress or trauma. You know, trauma and prolonged periods of intense stress can really affect the gut and the integrity of the barrier of the gut. Because here's the thing, and this is one of the first things I put up here. A leaky gut equals a leaky brain. And what do I mean by a leaky brain? So the brain is encased in a barrier. It's a sheath, right? And we call it the blood-brain barrier. And the blood-brain barrier is sort of like the barrier of your intestines. It's supposed to be and actually the barrier function of going into the brain and the nervous system is actually much more strict and tight than even the gut lining is. And so you want to have a really strong and tight barrier going into the brain. And what can happen is that when there's a leaky gut and there's damage, meaning those tight junctions between the cells get leaky, right? And the contents of the gut, of what you ate and the bacteria that are in your gut can get into the body. If you have a breakdown in the barrier of the blood-brain barrier, things that are in your bloodstream that are floating around that are not supposed to just automatically get into the brain, get into the brain. The brain, the body has tight regulation. The nervous system has tight regulation over what comes into the brain and what doesn't. And this includes things like immune cells and inflammation, proteins, large sort of inflammatory molecules, and toxins that might be floating around in your blood, and infections and virus particles that are floating around. You're supposed to be protected from those things coming into the brain. You're supposed to be protected from a lot of those things coming into the body. But if you have a problem with your gut, and this condition called leaky gut that we've talked a lot about, chances are you have a leaky brain. And what happens when there's this leakiness is you can get things like pesticides, heavy metals, toxins going into the brain. You can get infections, and all these things can damage your brain, can damage your nerve cells. And when those nerve cells are damaged, this is one of the mechanisms that you can get autoimmunity in the brain. When those tissues get damaged from the influx of bad things into the brain, the myelin gets damaged, and you can have autoimmune reaction against the damaged tissues. And so this is one of the ways you can end up with inflammation in the brain, is because of this leakiness. The other issue relating to the gut, so that's one mechanism, is the leaky brain. Harmful substances get into the brain and cause an immune reaction and inflammation. So that's one way. The other way, and this is tied to the gut. I just want to finish that thought, because it appears that once we fix the leakiness in the gut, the same process for fixing the leakiness in the gut helps fix the leakiness in the brain. And so repairing the gut helps repair the blood-brain barrier. And so we must really work on this. Very, very important. The other thing that really, the other thing to keep in mind about the gut-MS connection is that when you have dysbiosis, this whole idea of what else can go wrong in the gut, right? So we have leaky gut. And how do you get leaky gut? One of the ways is dysbiosis. We've talked about this. I think I've talked about it probably on almost every one of my Facebook Lives, so you can go back, and I have some that are purely subject matter, heal the gut. So you can go back to some of my gut talks. But dysbiosis is when the 100 trillion bacteria in the gut are not in a healthy balance. You either have an overgrowth of too many of the good bacteria, which you can have, and that's something called SIBO, small intestinal bacterial overgrowth. You can have an overgrowth of harmful bacteria, yeast, parasites. And so when you have this thing called dysbiosis, which is just the microbes are not quite right in the gut, that can lead to a damage to the intestinal lining and leaky gut. And what happens is the immune system, and this is sort of a foundational understanding of how you develop autoimmunity in the body. Okay, this is true for MS, this is true for all autoimmune conditions. Developing autoimmunity in the body can happen because the immune system, of which 70% of the immune system lies right below the intestinal lining. Okay? And we did this I did this last week, and I held up my leaky gut diagram when we were talking about RA. So you can go look at RA. So we're not going to do more of this other than for me to just point out and remind you that underneath the intestinal lining is the immune system. And there are all these factors in the gut that can cause the immune system to become overstimulated and damaged. And so there develops a foundational sort of problem with the immune system in its inability to turn off inflammation. It's like a runaway train. And there are these immune cells called T regulator cells, and they're the regulator. They're in charge of the gas and the brakes and keeping the immune system turning on when it's supposed to and then turning off when it's done, only attacking what it's supposed to and not attacking what it's not supposed to. And they're called regulators. That's a great name for them. They do exactly what it sounds like they do. And in autoimmunity, the T regulator cells aren't working right. And T regulator cells in an adult, the majority, 70% of your T regulator cells are developing and learning how to behave properly in the lymphoid tissue that lines your gut. And therefore, to have healthy, well-balanced T regulator cells that will prevent development of autoimmunity, and this is true for MS as well, you must have a healthy gut and healthy bacteria in the gut, because that's what's going to keep the lining intact, which will protect your immune system and will keep the blood-brain barrier, the downstream, and downstream always means several steps later, downriver, in the effects in the body. It'll help maintain the blood-brain barrier as well. And so this is the goal. And so with all my MS patients, I always start assessing the gut, and I also do stool testing to make sure the gut flora is good. But I always do assessing the gut as a very first step, and working on repairing the gut, making sure, checking for the leaky gut. There's some testing that we do to look for that. There's something called lipopolysaccharides that you can actually look for antibodies to LPS. And there's a lab called Cyrex Labs that actually, and Dunwoody, that do antibodies to LPS. And you can actually check then for that. That really helps you understand how leaky the membrane is. And so we can do this, and we can work on repairing it. And so that's really the main connection I wanted to share with you today. Now, in general though, in addition to looking at the gut, I will just say a few things, is that just about MS in general. There's definitely so what else are we looking for? So we're working on the gut, and what else is important in MS? And I want to share that I've had actually a handful of patients in my practice where the MS, it turns out that we believe the MS was triggered initially by Lyme disease. And there are other infections as well that can trigger MS. And so sometimes the mechanism isn't solely about, gut health. But I want to say that if you have a leaky gut and you have a leaky blood-brain barrier, it's easier for those infections to cross over into the brain. And so that's a real conundrum, when somebody has Lyme and MS. And I have a few people that we've really been struggling together to try to figure out how to, the best way to help treat this. And part of it is because treating Lyme disease, a lot of conventional docs are using a lot of very intense antibiotics. But to treat MS, conventionally speaking, the number one treatment is to shut down the immune system, right? As immune suppressants. And if you suppress the immune system, the Lyme is not going to get treated. So in a way, the treatment for MS, if you have Lyme as an underlying cause, then you're going to impair your ability to really treat the Lyme. And so this is a real big catch-22 for people. So if you've got MS and you haven't been tested for Lyme, I guess the moral of the story is make sure somebody sends you, if you have MS, you should definitely make sure somebody sends your blood to a good sort of Lyme lab, like Stony Brook on Long Island. I use IGeneX in California. Make sure you're tested for Lyme and that there isn't something else going on. And you might need to have treatment for both at the same time, which is a little tricky, like I said, because of the immune suppression from treating MS can impair your ability to treat the Lyme. The other infections that the literature has sort of just talked about in terms of MS is two infections, one called chlamydia pneumonia and the other one Epstein-Barr virus. And it's a little bit of chicken and egg. People aren't really sure whether or not the damaged nerve tissue ends up with the viruses sort of invading after the damage first starts. But once the virus or chlamydia is a bacteria, once you get an infection inside your nerve cells, then the immune system takes over and tries to get at it, and thus therefore it's really working on attacking those nerve cells because of that. I think it's really important to ferret out infections wherever you can find them, to just check and make sure there's no infections there, and to treat those infections while you're also repairing the gut to treat the immune system. You with me? So even though there might be other things at play, and that's really the point I'm trying to make, other things at play, so there might be infections at play, but you still have to repair your gut, because ultimately repairing the leakiness is what's going to protect your brain and allow and prevent more infections from going in, but it'll also, more importantly, help you repair your immune system so that it works properly and slows down the autoimmune sort of process. The other category of things that we also address for multiple sclerosis are toxins. You know, things like mercury, which can, if you have a leaky brain, the mercury can really cross over into your brain. And some of you might have experienced already that, you know, if you've done any work with an integrative person and you have fatigue and brain fog and you got tested and somebody told you had high mercury levels, and then you do like a detox program which supports the liver, maybe even end up doing some chelation programs which clear the metals out, and your brain fog gets better and you feel better. You know, energy improves, brain fog improves. It's because those metals can cross over into the brain. And they can cross over in very big amounts if you have a big toxin exposure or long-term and you have a leaky gut and leaky brain. So I hope you see the point I'm making, right? So the gut is always the foundation. Fixing the gut, repairing the barrier will help, and reducing inflammation, helping getting toxins can damage the lining of your gut and the barrier, and toxins in your body can damage the blood-brain barrier too. So there are other ways the barrier to the brain gets damaged as well, and not just via the gut, but also directly from toxins. So toxins are really important. And so at the same time that you're checking yourself for toxins, now, if you need to figure out how to do this, it just occurred to me that a lot of you watching might not be seeing an integrative doctor or a functional doctor. If you have any serious autoimmune disease or complex like chronic illness that you think is immune related, yes, you can always find a functional medicine practitioner, whether you want to come here at Blum Center for Health. There's 6 of us that sees patients, but you can go to functionalmedicine.org and put in your zip code, find a practitioner, and see if you can find a certified functional medicine practitioner to help support you. But you can also start on your own, and for those of you who don't have any kind of diagnosis or debilitating health condition, but you're aware that you might have toxin exposure, or you want to check on how to make sure your gut's healthy, or whether or not you have toxins, that's what I wrote my book for. I wrote my book for you, the first book. My book on arthritis is coming out in the fall. I'm excited. We'll talk more about that as the months go. But the Immune System Recovery Plan is a 4-step program for treating autoimmune disease, and that includes MS. And it's looking at food, stress, healing the gut, and supporting the liver with detox. And it's a workbook. It'll take you how to heal your gut, and why. It'll take you how to eat an anti-inflammatory diet. What does food have to do with it? How does food trigger autoimmunity? It'll talk about stress, and I already shared at the beginning about how stress can damage the gut and cause leakiness and change the microbiome. And finally, I do a whole sort of a self-assessments where you can try to understand, is it likely that your gut is damaged? Is it likely that you have a high toxin load? And so I tried to give you all those resources to do it yourself. And I do believe, from the emails I've gotten from thousands and thousands of people, I think my publisher just told me we went into our 19th printing. I have about almost 100,000 books in print, that are out now. And so the book has really helped a lot of people, and I've gotten so many wonderful emails from people thanking me and sharing their stories. So thank you for that. And so I would direct, if this sounds interesting to you, or you know somebody that has autoimmune disease, like MS, really, but any autoimmune disease, because again, what they all have in common, that's why I wrote the book, because what everybody has in common is more important than what separates them of these different diseases. So I'm going to take a break for a second. There's a question. Okay, good. Excuse me.
Do you think vaccines play a negative part in gut health?
Really good question. Oh boy, big can of worms. So the question is about vaccines. And she let me, whoever asked the question, he or she, let me off the hook that they didn't ask me about vaccines and autoimmunity. They asked me about vaccines and gut health. It's very interesting because the gut gets damaged very, very easily by different things. Now, it's interesting when it comes to vaccines, there's a great new study this year on something called ASIA, induced by adjuvants, autoimmune syndrome induced by adjuvants, it's called. Anyway, it's a condition called ASIA. And what the studies are looking at is reactions to the adjuvants in the vaccine, not the mercury. All right, so I'm not saying the thimerosal, and I'm concerned about the thimerosal and the mercury, but I'm also concerned about the aluminum. Now, think about it this way. I'm gonna sort of rock your world a little bit, because I'm gonna give you a whole nother way of thinking about the concerns about vaccines. How and why do they work? Vaccines work because in the shot you're going to get sort of a little piece of the infection itself, so that your body will mount an immune response to it. And it's thought that the infection piece you're getting, sometimes it's live, it's called live attenuated. Sometimes it's usually sort of dead, right? Dead virus that's sort of inactivated, but the proteins are there enough so that your body recognizes it and makes an immune response. In order to guarantee that you have a good immune response, that there's good immunity that develops after that shot, you actually, what the researchers and pharmaceutical companies do is they've mixed in usually aluminum into the vaccine so that it irritates your body, your immune system, and amplifies the reaction. They're actually going for trying to amp up the reaction to the vaccine so that you're guaranteed that one shot will give you a good immunity. And this is called an adjuvant. An adjuvant is like a mixer. It's something that's mixed in, right? It's an extra compound that's mixed in to the formula. And it turns out that the aluminum that's in those that's in those immunizations are triggering autoimmune reactions in the body. And you can go on PubMed and search for, like I said, ASIA, autoimmune syndrome induced by adjuvants. And in 2016, there was a great article that came out sort of identifying how disruptive this is for the immune system. And so in that way, the concern is not only the mercury and the thimerosal, but I'm actually just as concerned about the aluminum. And you can't find a vaccine without an adjuvant in it, because adjuvants are the whole foundation for the effectiveness of the vaccine. And so, does it damage the gut? I don't know, actually. I know heavy metals in general do damage the tight junctions and will damage the gut. So I would guess that the aluminum and the adjuvants are damaging the gut. I don't think the vaccine, I think the damaging aspects of vaccine, I'm not sure that it's through the gut. I'd have to actually go look at that. So I don't know I can answer that part definitively, but I will tell you that the vaccines, they're damaging the immune system, but I'm not sure if it's via a gut mechanism, I guess is what I'm saying. So, but it's damaging the immune system because it's really an overstimulation of the immune system in a way that the immune system then gets like a runaway train and doesn't shut off. And the adjuvants and the metals sort of add to that problem. And then, as you know, if you do multiple vaccines at once, if you think about the amount of aluminum you're dumping into a little baby, at the beginning, you have a big problem. And if you have a gut issue, and you have, for any reason, a leaky blood-brain barrier, that aluminum is getting into the bloodstream and getting into the brain, thus causing inflammation. And so when it comes to things like autism and the whole discussion about vaccines and systemic complications, and especially neurologic conditions, it's the leaky brain barrier is really an issue. And so that is where the gut health does, of course, come in, protecting you from, if you're getting a vaccine, you're bypassing the gut, right? So let's just separate that for a second. If you're getting a vaccine, you're not swallowing it, although polio is oral. But most vaccines come in directly to the bloodstream. So I'm just sort of rethinking my answer to your question. So taking it a step further, or probably the best way to think about this is you're getting these aluminum directly into the blood, and then what's happening is if you have a gut issue, you have a leaky brain barrier, and the aluminum is getting into the brain. And so that's really, I think, my biggest concerns, and that's where maybe, I guess I digressed into sort of the relationship potentially between vaccines, the gut, and autism, right? Because if you have leaky gut, leaky brain, the aluminum, and maybe even mercury can get right in. So I hope that made sense. It's a little bit of a complicated story about that. So when I said about heavy metals damaging the gut, I was talking about when you eat them, not through a vaccine, right? Because you have to sort of swallow those and eat them, and we're getting tons of mercury through our food supply. So you have to be really, really careful about mercury in the food you're eating, in the fish. And go on the environmental working, I'll leave you with this thought. Go on the environmental working group, ewg.org, and they have the whole healthy fish list. And so be very careful, because toxins and metals, I don't know that you're going to eat too much aluminum. It's more from the vaccines probably, but certainly people are ingesting mercury, and that will damage the barrier of the gut, and then it will leak into the bloodstream, and then damage the blood-brain barrier and cross into the brain. And that's where you really have a big risk for MS. So I've definitely worked with chelation and getting mercury out with my MS patients, and that's something in addition to making sure your gut is healthy, you need to look at again as well. And so if you think this is you, I'm going to remind you to go and find a functional medicine doc to help you sort this out, because it can be complicated. And multiple sclerosis is a potentially devastating and fatal illness if it progresses quickly. And working in a functional way by really looking at all these roots, looking at all these foundations that can trigger autoimmunity in the nervous system, is the way to slow things down and potentially even nip it in the bud, especially if you've been just diagnosed and it's early. So I'm going to leave you with that thought. Really nice to be with everyone for lunch. I hope you ate something healthy today, anti-inflammatory and good for your immune system. Have a great week, and I will see you all next week.